My name is Tayleigh. I'm a registered nursing student at Northwestern State University, and I'm going to be part of your healthcare team today. Is that okay with you? Perfect. Can you tell me your full name and date of birth?
9/18.
Perfect. I have provided privacy for my patient, and vital signs have been obtained. I'm going to go ahead and raise the bed up, and I'm going to ask you a few questions, okay? All right. What brought you into the hospital today?
I am having
Okay. Have you had any issues with your appetite or sleeping pattern? No. Okay. And what is your name?
Destiny.
Okay. And do you know where you are? And do you know what today's date is?
February 4th.
And what brought you into the hospital today? Just your knee pain. Okay. My patient is awake, alert, and oriented ×4. Can you point and show me where the pain is at? Right there. Does it radiate at all?
When I'm walking.
When you're walking, okay. Does it pulse or stay the same or stays the same? Okay. Does anything aggravate it?
Just walking.
Just walking? Okay. And have you done anything at home to help with the pain?
Tylenol.
Tylenol? And how often?
Once a day.
Okay. And if you had to give yourself a pain level of 0 to 10, 0 being no pain and 10 being the worst pain, what would you give yourself? About a 5? Okay. Well, I'm sorry you're having that pain. And like I said, we're going to do this assessment and then we'll get it taken care of, okay? All right. I am going to start by looking at your eyes, okay? All right. How many fingers am I holding up? 6. Okay. And I'm going to have you just look straight ahead and I'm going to shine this light in your eye, okay? All right. Keep looking ahead. All right. Now I'm going to need you to follow my pen with only your eyes, okay? All right, the pupils are round and equal, reactive to light and accommodation. I have performed the 6 cardinal fields of gaze, and now I'm going to assess your mouth and mucous membrane, okay? Have you had any issues with swallowing or swallowing? Okay, I'm going to have you say off. All right, the uvula rises, the soft pink soft palate rises with symmetry. The mucous membrane is pink and soft. You said you had no problem swallowing. And can I have you smile for me? All right. Puff out your cheeks, grit your teeth, and raise your eyebrows. Okay. For your mucous membrane, I didn't see any lesions or dentations, and I didn't see any lateral deviations for your face. All right. Can I have you push against my hand, please? All right. Push against my other hand and shrug your shoulders. Perfect. Bilaterally good. All right. Now I'm going to listen to my client has had no problem hearing me and is answering my questions appropriately. Inspecting the mouth, I noticed that the moisture is appropriate and the skin color is appropriate. And now I'm going to listen to your respiratory, okay? Sit up. Grab my little thing here. All right. I just need you to breathe normally out through your mouth, okay? All right, the chest rises and falls symmetrically, and the respirations are even and unlabored. And now I will inspect the posterior. Can I have you put your chin to chest and give yourself a hug? Perfect. Just breathe normally, okay? All right, listening laterally to the left. I know that the left lung has 2 lobes. Listening laterally to the right. I know that the right lung has 3 lobes. All right, the posterior respirations were even and unlabored, and have a normal rest. They're equally normally. You're fine. Normally, they're even. They're good. All right, now I'm gonna listen to your heart rate. Okay. All right, I just need you to sit back and relax. All right, listening to the aortic at the second left intercostal space, the pulmonic at the second right intercostal space, Herb's point at the third right intercostal space, or Herb's tricuspis at the fourth right intercostal space, and the mitral at the fifth right intercostal space at the midclavicular line. All right, S1 and S2 are heard distinctly. The heart rate is regular with a rhythm that's regular with +2 strength and 60 beats per minute. Now I will assess your abdomen. I'm going to lay you back, okay? Have you had any pain on your abdomen? No, ma'am? Okay, perfect. This. All right. Okay. Oh, I'm going to make sure that there is no edema, lumps, nodes, or superficious venous patterns. I'm also making sure that the stomach is flat. Can you put your chin to chest and cough for me? I'm inspecting to make sure there's no hernias. All right. And you said you had no pain, right? Okay, so now I'm going to first listen, starting at the right lower quadrant. Right. I'm going to have you move your hands for me. Right. Right upper quadrant, left upper quadrant, and left lower quadrant. All right. And now I'm going to percuss in the same order. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and I will palpate in the same order as well. Right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Have you had any trouble with urination or bowel movements? And when was your last bowel movement? Perfect. All right, and now I'm going to assess your periphery and skin, okay? Looking at the patient, I noticed that the moisture is appropriate and the skin color is appropriate for the ethnicity. I don't feel any temperature, no edema, skin turgor looks good. I will check the bilateral pulses. All right, they are bilaterally equal with a +2 strength. The rhythm is regular at 60 beats per minute. I'll check your cap refill, less than 2 to 3 seconds. So the upper extremities look good. Now I will assess your lower extremities. They look, and your upper looks symmetrical. Your lower, I'm going to have you uncross your legs. The lower extremities looks symmetrical. There's no moisture. The color is appropriate for the patient's ethnicity. There is no temperature. Cap refill is 2 to 3 seconds. No edema. I'm going to check the duralis pedis pulse. It is +2 strength. Rhythm is regular at 60 beats per minute. And now I'm going to roll you on your side. Okay. I'm going to help you roll you on your side. Perfect. I am inspecting the head and the scapula, the coccyx, and the heels for any lesions or abrasions, and everything looks good. I'm going to roll you back over. All right. And now I'm going to sit you up. Feeling okay? Feeling good? Perfect. All right. So now I'm going to have you, let's get you to a good height here. I'm going to have you grip my fingers, bilaterally equal. I'm going to have you push down like you're pushing on the gas pedal to check your plantar's flexion. Perfect. Push up to check your duralis flexion, bilaterally equal. All right. Everything looks good. I'm going to lower your bed. Ooh, right there. Is this position comfortable for you?
Yes,
okay, and are you having any pain right now? Just the knee pain? Okay, and do you need any help going to the bathroom? Not right now? Okay. Well, let me check your IV. Everything looks connected. There is no redness at the IV site. I have moved this out of the way so that if you need to get up while I'm gone, the call button is within reach. Your side rails are up for your protection. And if you have any questions, just let me know, okay? Thank you.